So now that we talked about the loop diuretics and we talked about the thiazide diuretics, as well as potassium-sparing diuretics, if you still need some extra diuretic help, you can add some metolazone, and that will help in terms of being able to offer an additional additive effect for diuresis. Now, of course, we have to be a little bit careful with our electrolytes, and we have to be a little bit careful with the renal function. So, we talk about loop diuretics quite a bit, and that's one of the mainstays for diuresis. So I do want to make sure that we know the difference between the different types of diuretics. So let's talk a little bit about the pharmacodynamics and the pharmacokinetics of the different loop diuretics that are available to us. We all know about furosemide. Now with furosemide, the downside is that the IV and PO availability is a little bit different. So we've all seen that case where we take our patients, give them almost max dose of PO Lasix, but it still doesn't help. We take them into the hospital and we give even just 40 milligrams of IV furosemide and they diurese very effectively. Well, the thing about that is that we have to be careful about being able to do that in the hospital, in the non-hospital setting on a regular basis. It also doesn't last as long. So for my patients, for example, instead of telling them to take it 3 times a day because of the half-life of 6 to 8 hours, what I tell my patients is take it at 8 o'clock in the morning and 2 p.m. And this way, what can happen is it allows them to sleep through the night without having to get up all night to wake up to go to the restroom. Of course, the downsides of doing that also is that they might wake up and get up too quickly, become orthostatic, and fall. The next one that we use is bumetanide and actually torsemide. The nice thing about these two drugs is that bioavailability is almost 100% for PO, or IV. So whether you give it PO or IV, it's pretty readily available. It only takes about half an hour to about an hour for it to really start taking effect, and it lasts a little bit longer. Even though the slide says about 8 hours or so, typically in practice, you can usually dose these even once a day with pretty good effect, especially torsemide. Give them once a day, 10 milligrams or 20 milligrams, and you can get very effective diuresis. So the PO availability, the bioavailability, and the longer half-life is actually more convenient for patients and probably will allow them to have better diuresis than furosemide alone.